The Center for Pediatric Medicine is the largest Medicaid clinic in the state of South Carolina. We serve over 23,000 patients and have over 50,000 visits a year. As the largest Medicaid clinic in the state, our patients oftentimes have unique socio-economic challenges, sometimes single family, sometimes poverty, sometimes lack of transportation. So we have to be creative in terms of how we deal with those populations. Some of that is having night clinics. Some of that is actually making sure that the transportation is provided through Medicaid. Some of that is recognizing that our patient population might not be on time all the time for their appointments. Sometimes they might miss appointments. And it's not our job to turn them away. It's our job to be as welcoming as we can and do everything we can for them. Center for Pediatric Medicine, because of its diverse population, needs to provide a diverse sample of services. To do that, we have the lactation services, we have social services, we have care management services, we have Medicaid services in the office, we have Hispanic support services in the office, we have WIC, which is Women, Infant, and Children's Nutrition services in the office. We have asthma educators in the office, but we realize that we really have to do so much for so many people, and we want one-stop shopping. We don't want somebody to be seen and then have to go somewhere else. The South Carolina Quality Through Technology and Innovation Program, or we call it QTIP, is a tremendous program that's been set up by the State Department of Health and Human Services to look at ways to innovatively improve quality in pediatric care. Over 30 practices across the state have been enrolled. We are the largest practice that's enrolled. And through that, we've been able to innovatively look at ways to improve our ability to detect postpartum depression, how to enhance dental health, how to enhance weight control, how to enhance adolescent depression detection, and a variety of other things. We're always excited about what we can be doing to improve the health of our children and their families. Back in 2015, the Filato Center for Complex Pediatric Healthcare was started. This was a move from a program that had been out at Baptist Easley to see patients that have complex pediatric healthcare needs. For example, children that have significant developmental disabilities, children that cannot feed on their own and have to have a tube placed in their stomach to have feedings, children that have such complex lung disease that they have to have a tube in their trachea. All the while they're being taken care of at home, our job is to make sure that we emphasize and support them to stay out of the hospital and to do everything they can to keep the family unit intact. It's such an incredibly rewarding process to take care of these families in this setting with an incredible team of people.